Hi, my name is Matt Messer. I'm the Chief of Public Safety Services for the City of Holland. Hello, Mayor and City Council members. 2021 was an overall positive year, and it's hard to believe that it is 2022 already. We look forward to many accomplishments and achievements in 2022. Just a brief overview of 2021 would include staffing. As far as fire, our staffing levels remained consistent. Police, we have had some key retirements, and we'll be seeing more within the next couple of years. Call volumes, fire, we are definitely seeing an increase in emergency medical calls. Police, our calls have remained steady over the last couple of years. Both police and fire are seeing a steady increase in mental health crisis calls. And of course, we are still dealing with COVID-related calls for service and staffing concerns. As many of you have seen and heard before, I'm going to start today with what our organization always starts with. Everything begins and ends with our core values and purpose. Whether that is the calendar year, fiscal year, budget process, or anything else, the focus on core values and the continuous pursuit of excellence remains the same. We integrate our core values into our processes, decision-making, and vision. Core values impact the budget process and direct us to what the priorities are for our organization. More importantly, they help us identify what is needed to provide the best services to the visitors and the citizens of Holland. The current budget update, let's run through each of these one by one. The fire aerial truck, crisis intervention team, accreditation process, WatchGuard body cameras, self-contained breathing apparatus, the video training simulator, and the Robinson Brain Health. And I will have a slide for each one of these. Fire aerial truck, that was placed into operation in June of 2021. We did have a few delays with some of the warranty work that needed to be completed. This is a very important piece of equipment for the fire services, and we're very glad to have that in service. It's been working well, and it's meeting our current operational needs. Crisis intervention team, as I alluded to, we continue to have an increase in levels of mental health crisis incidents that we've been dealing with. The Holland Police Department is currently in a partnership with Alva County Sheriff's Office and Community Mental Health. The crisis intervention team started in October of 2021, and they currently have office space within the Holland Police Department building. That team has been working closely with our community policing team. It has created teamwork and direct communication between law enforcement and the community mental health workers. During the first 2 months, this team has been involved in 34 cases. Those cases are just within the city of Holland, and those cases continue to rise. Accreditation process, I mentioned this last year as well. We started the training and research on this in the fall of 2019. We went through the policy and procedure review. We started that in October of 2020. We are approximately 75% completed, and we expect the completion date to be sometime around the fall of 2022 when we will receive our accreditation. Several team members have been involved with this, and it's been a very time-consuming venture for sure. WatchGuard body cameras. We received the new body cameras in November. We filled the FOIA position in December. The policy and testing occurred in both the months of November and December 2021. Full implementation occurred on January 1st. We currently are in a 5-year use and service agreement with WatchGuard body cameras. Self-contained breathing apparatus. These pieces of equipment are scheduled to be replaced every 10 years. They have been scheduled and funded from the Municipal Capital Improvement Fund. The current equipment that we have now was purchased in 2010. Proposed delivery and implementation of the SCBA will be in the spring of 2022. Video training simulator. The video training simulator system has been purchased and scheduled for installment and to begin officer training the first quarter of this year. It was also scheduled and purchased from the MCIF. This training simulator incorporates all different levels of force, including verbal de-escalation, taser, less lethal, handgun, and rifle. It creates scenarios to deal with people struggling with mental health. It also will create scenarios to watch for implicit biases. It has the ability to run scenario trainings without the need for role players, and we will be able to do it with fewer instructors. It also has a 180-degree screen to work on situational awareness and dealing with people in different areas versus just downrange. It also has a video playback to show an officer their decision-making and their own reactions. It will also be used for the Citizens Police Academy or other community groups, city council, media, or attorneys to show the split-second decisions that officers have to make while dealing with high volumes of information at very fast speeds. Robertson Brain Health. We are involved with the continuation of the results and implementation of strategies from the data collection process. It's providing our organization assessment of different teams and subsets for command staff review and vision for the future. The command staff has had several meetings with Dr. Joel Robertson and have additional meetings scheduled in 2022. As far as the future budget year, the fire station process is obviously going to be the largest project over the next probably 2 or 3 budget cycles. Believe it or not, the research and development did start in 2014 for these, where we looked at different properties and call response time, so on and so forth. But as far as this year, we're working with KZF Design and GMB Architecture. We're currently in the contracting phase, and the estimated new Waverly Station starting date will be somewhere in the 3rd quarter of 2022. Mobile Command Unit. This unit was originally obtained through a grant and placed into service in the year of 2000, and it was actually put into service as a mobile breathalyzer unit at the time. It's too small for complete incident command during VIP visits, tactical or hostage type events. It also has no built-in generator and limited technology ability. This unit has been in prior budget processes and has been delayed due to other purchases that we had to make. We currently are in a need for an upgrade with this particular unit and have met with vendors to start the research process. In conclusion, I wish to thank all of our staff for their hard work and dedication to the organization and to the city. I'd also like to thank City Council and City leadership for their continued support of the Public Safety Department.